workers who are looking after them right after that. Anthony?
Charlie D'Agata in London. Thanks, Charlie. Here in the U.S., if you need a more stark example of how bad the pandemic is, take a look at this. We have just recorded the second highest single-day death toll since the pandemic began. Nearly 2,600 people lost their lives. We're also seeing progress this morning toward a CDC recommendation on who should get the vaccine first once it's approved in this country. Our lead national correspondent, David Begnaud, is in Indianapolis this morning. David, good morning.
Good morning. So slightly different here, Anthony. The CDC is saying, listen, let's give it to healthcare workers first and then folks in long-term care facilities like the elderly. Notably, in the conversation I had with the CDC yesterday, they said we not only want to give it to doctors and nurses, but also like the custodians who are cleaning the rooms, removing the waste. They're just as much at risk as the doctors and nurses. Here's more from our conversation.
The fact that we have a limited supply means that we have to be very selective in who we give this to.
Meet Dr. Jose Romero. He is chairman of the committee at the CDC that is making these recommendations, which will affect all of us. Among those selected for Group 1A are frontline medical personnel and seniors living in long-term care facilities.
The reasons we have selected these two groups are based in science. They're based in equitable distribution of vaccine and maximizing benefit and minimizing harm.
According to CDC analysis, there are about 3 million people living in long-term care facilities. Then there are roughly 21 million healthcare personnel, including non-medical, custodial, and administrative staff, who will also get the vaccine first. And that's about 24 million people in just Group 1A. Both vaccines are going to require 2 doses, several weeks apart. So that's roughly 50 million doses for just those 2 groups of people. Right now, there's only about 40 million doses available. So that means most of us, most Americans, will still have to wait several months for a shot in the arm, according to former CDC Director Dr. Tom Frieden.
Companies are ambitious in what they say they can produce, and we hope they're right. But remember, earlier this year, we were told there would be 300 million doses by the end of the year, then 45 million, then 40 million. So it's been a shrinking number. It's still an amazing, close to miraculous accomplishment, but we can't let optimism get in the way of reality.
Given all this information, the reality is the pandemic is far from over, and it's taking an emotional toll on frontline healthcare workers like Dr. Scott Samlin. He's an ER doctor in Hammond, Indiana, just outside Chicago. We spoke to him at the very beginning of the pandemic in March, and this is what he said.
This is the most scared I've ever been being an ER doctor.
I spoke to him again yesterday.
And every day is Groundhog's Day. There's only so many 12-hour shifts you can do in a week. Go home, sleep, sanitize yourself, and go back for more. I mean, this is just a marathon, and every day it's the same. COVID patients, people sick, people on ventilators, people dying.
Scott said the infections that are coming into his clinic, more people are infected. He said even more than hospitalizations and deaths, David. It's just off the page how many people are walking in and are positive. Before we go, let's talk about the Dakotas. I mean, there is just an explosion of COVID there. Take North Dakota, for example. One of our colleagues went and got video of the line of people waiting to get tested in North Dakota. They do it once a week. It is free. In fact, the person who runs the health agency there told us, I could do it every day. I just don't have the staff to do it. Gail, 1 in 4 people in North Dakota